Hi everybody, hope you're well. I wanted to show you just a couple of quick exercises that I think are really lovely to do to encourage a bit of thoracic extension, a bit of pectoral opening, just creating a little bit of space in around the shoulder blades. I think it can be really nice to start off maybe with getting the yoga tune-up balls up against a wall and just loosening up this space with the balls. Along the medial border of the scapula, just that whole rhomboid area here, maybe up a little bit into upper traps, levator scapula. So just standing against the wall, using the ball to massage those out. I'm going to be lying down for these exercises, which is rather unusual because I'm a fan of exercises that you can generally do standing or sitting, but these are really nice, as I said, for just creating a little bit of space in this upper part of the thorax. So this is just a regular yoga bolster. I have it flat on the ground here. Sometimes having the bolster completely flat on the ground can be a little bit challenging. So what you can do is you can just get a yoga block and just put it underneath the bolster, and we'll just line up the bolster here beside it. And then I'm going to turn around and I'm going to sit at the end of the bolster and just lower down over it. Okay, so it should feel comfortable. My knees are bent, my feet are flat on the ground, and I feel the support of the bolster running along my thoracic spine, but my head is also well supported. If I wanted to, I could get another yoga block and put it underneath the bolster if my head needs to be up a little bit, so just to get the bolster up a little bit higher. But this actually feels really nice right here. So to start with, we always start with the breath. So one hand on the chest, one hand on the tummy, and just see where the breath is. And just really trying to send the breath down, right down into the tummy. So we're getting a little bit of abdominal expansion, but we're also feeling the pelvic floor lengthen away with the inhale and then relaxing with the exhale. So we're keeping the chest still and quiet first of all, and trying to send the breath down. And then after a couple of cycles of that, we're going to send the breath wide. So really feeling the thoracic spine supported by the bolster, feeling the rib cage almost draping either side of the bolster. So we're creating space, feeling the collarbones getting a little bit wider, tummy relaxing, spine is supported, knees are bent, feeling the feet planted on the ground, scrunching the toes and then relaxing them again. Keeping the jaws nice and soft and relaxed. So I really want you to encourage practicing breathing in and out through the nose. So if you can keep the lips together but the teeth apart, that's a really nice relaxed position for the TMJs, and often that's where we carry a lot of our tension and stress. So just following the breath, paying attention to the sensations, noticing any distractions and then letting them fade away. So the next thing we're going to do are just some chin tucks. So very gently, I like to rest the two hands on the tummy for this. Take a deep breath in, exhale, tuck the chin down and in, and relax back to the center. So inhale, exhale, tuck, and release. Inhale, exhale, tuck, and release. So the inhale is really sending the air down, really trying to fill up both of the lungs. With the exhale, we're tucking and then releasing it back to the center. So it's not a huge movement, but it's just to start working those deep neck flexors and to start creating some space around the back of the neck. So I like to do about 5 of those. So inhale, exhale, tuck, and then release. One more. Inhale, exhale, tuck, and release. And then resting, if it's comfortable, resting the hands on the floor, either side of your hips, palms up to the ceiling. So if that's too much of a stretch across the pecs, if surgery's been quite recent or just that flexibility hasn't come back, you can just keep the hands resting here on the tummy. You could put a pillow underneath the hands out here to the side. Just find somewhere that's comfortable to be. So if it is comfortable, have the hands on the ground, palms up to the ceiling, and we're going to inhale, shrug the shoulders up. Exhale, slide your shoulder blades down towards the hip pockets. Inhale up, exhale down. So you want to think about your collarbones staying nice and wide for this. Inhale up, exhale down. So you're sliding the whole arm up. Don't let your chin stick up. Keep the chin gently tucked in. The back of your neck is nice and long. Inhale up, exhale down. If you were doing that with the hands on the tummy, it's going to look like inhale up, exhale down. So you really want to focus on the movement of the shoulder blades, up and down. From there, we're going to see if we can get the elbows onto the ground, or as close to the ground as you can. So we're doing this on both sides. Okay, so this hand is also, it's mirroring this one. So we're bringing the elbows back down to the ground. Gorgeous stretch into a little bit of thoracic extension, but really lovely stretch across the front of the chest. And then we're going to bring the arms around in a big circle as if we're trying to hug the world. So the elbows stay bent, and then we're going to go back down. So we're going up, hug the world, and back down out to the side again. And actually it's quite nice to look to either side as you're doing this. So we're going to inhale and to this side, back to the center as we breathe the arms back down, looking to this side, back to the center. And again, really just trying to get that feeling of creating width across the collarbones as we're dropping the elbows back down. That's really going to deepen the stretch, pec major, pec minor. But as we bring the hands up around in that circle, as if we're coming up in a circle to hug the world, so the elbows are still bent, we're trying to really feel the shoulder blade, your scapula, coming around the rib cage. So we're coming into a little bit of protraction, and then we're allowing it back. So really feel like you're hugging a big beach ball here. Shoulder blades are coming up and around the rib cage. Don't let the ribs pop up. So you want to keep them, gently tucked down towards your pelvis. But we're circling the world here, and the shoulder blades coming around the rib cage. So we're starting to get that relationship between serratus anterior and the external oblique, and we're just starting to create a little bit of movement back and forth here. And this is going to be really important, particularly if somebody is having adjuvant radiotherapy after breast cancer, because if the shoulder blade and serratus anterior aren't mobilizing properly, that can cause a lot of tension in pec minor as radiotherapy goes on, and that can be a driver for some costochondritis, 4 or 5, even 6 months into radiotherapy. So this is a really nice preemptive exercise to do, maybe after surgery, before radiotherapy starts. So hugging the world, again, think really knitting down serratus anterior into the external oblique, bringing those shoulder blades around the rib cage, creating that nice little bit of glide. From there, we're going to do some arm scissors. So the two arms are, the two hands are pointing up towards the ceiling here. So you can see this hand here, my elbows are straight, and we're just going to go back as far as is comfortable. The other hand is going down towards the floor. So the ulnar border of the hand is coming down towards the floor. And then take a deep breath in, and as we're coming back up to the center, and then we're going to breathe as we swap, and just go as far as is comfortable. Don't force it into any distress. So nice and smooth. We're looking for control of this movement. And all the while we're doing this, the breath is moving constantly. The thoracic spine is really opening up beautifully here. And that's going to be great for, again, if we were worried about costochondritis or any restriction around the rib cage. And this is also mobilizing the shoulder blades as well. Good. So we're going to come back into the center. So the arms are straight up, fingertips are pointing up towards the ceiling. And what we're going to do are some serratus circles. I'm going to just scoot over here a little bit so you can watch my shoulder. So I'm stretching up and down. So the circle isn't coming from the ball and socket of the humerus into the socket here, the fossa of the scapula. I really want you to think about the whole shoulder blade moving with this. So we're protracting and retracting, protracting, retracting, protracting, retracting. As we reach up, we're reaching down and up and circling back, and then we can change direction. So we're stretching up, down, and in. Again. That's it. Just keep the breath moving, but really try to feel like the movement is starting from your shoulder blade. And be aware of the sensation of the shoulder blade moving around the rib cage. Good. And then just pause with the fingertips pointing up to the ceiling and just stretch up towards the ceiling, and then let the shoulder blades sink back down towards the floor. Stretch all the way up and back down towards the floor. All the way up and back down towards the floor again. And I think it's quite nice to finish up with just a couple of squeezes. I love working in this position with the arms up towards the ceiling because gravity is really going to be helping out our lymphatic system here if it's been compromised by radiotherapy or by surgery to the lymphatic nodes. So those are just a couple of strategies that you can do very, very simply, just lying down. You know, you could use a yoga mat rolled up and put that on the ground underneath the spine, even a big bath towel rolled up. But I think it's quite nice if you have one to use the yoga bolster, because we can get just that little bit of an extra prop underneath here if we don't want to go the whole way down into extension. I hope you'll give that a try. Let me know how it works out for you, and if there's any problems, tag me in the Facebook group. Thanks for watching. Bye for now. So if we want to think about some more seated options for a little bit of post-op mobility, whether that's after breast conserving surgery or mastectomy or reconstruction, sometimes it's just easier to integrate an exercise program into a seated position. It's safe, it's not maybe as much of a stretch as lying down, but it's a gateway towards calming down the nervous system and reintroducing a little bit of movement. So we'd always start with the breath, and just to check in with the breath and see where it's moving to, where maybe it's a little bit restricted. So I always like to start one hand on the sternum, one hand on the tummy, and just follow the breath. Don't try and change it, just see where it's going. And I think sometimes just the act of checking in with the breath can bring you back into yourself, get you out of here and back into your body again. So we want to try moving the breath around to do two things, to calm down the nervous system, to decrease any tension or muscle guarding that we might not even be aware of, but also to get that lymphatic system moving a little bit as well. So you'll have done the lymphatic drainage, the self-manual techniques that we've talked about before in other videos in the course. But don't forget to use the breath to move the lymphatic system as well. It's a really important aspect of good lymphatic function. So first of all, we're going to send the breath down into the tummy. And again, this can be a little restricted if there's been an abdominal reconstruction like a tram or a DIEP, or even a tug, because that can affect the pelvic floor and decrease the amount of available excursion. So just see what's comfortable, see what you can do without forcing, but just bring awareness to the tummy. So as you're inhaling, tummy's expanding, pelvic floor is lengthening and softening. And then as you exhale, just try to let everything go. So you're just slowing it down, you're bringing awareness, you're not trying to force anything with the breath. Then we're going to move our hands to the lateral rib cage. If you haven't got the mobility, say it was this arm to reach round and internally rotate, certainly a belt or a towel or a scarf around the rib cage would give you that similar proprioceptive input. So we're going to put the hands onto the lateral rib cage and just direct the breath into the hands. Imagine that you're trying to push your hands away with the breath. If you're sitting in a chair with a back to it, just rest against the back of the chair. Feel the chair supporting your spine, your shoulder blades, and breathe into the part of your body where the chair is holding you up. And I think the part that often gets neglected is the last part. This is a really important aspect of breath training after breast cancer treatment, because your lymphatic system is draining behind your collarbones. So we want to make sure there's plenty of space and room for that lymphatic system to empty efficiently. So we can inhale up and just drop the shoulders with the exhale. And it's lovely as well for just letting go of some tension that you might not even realize is there. So inhale up. You could inhale up, and as you exhale, you could look to one side or the other. So inhale up, and again, creating some space along the side of the neck, right down into the collarbones. Remember, your sternomastoid is attaching from the sternum, your clavicles, all the way up into the mastoid process of your skull. So we could inhale up, exhale, and rotate. And again, just opening up some space. So once we've deepened and widened and softened the breath a little bit, we want to think about just starting to create a little bit of mobility, particularly around the shoulder blade, your scapula, and the rib cage and the clavicle, because these can often become quite stuck down after surgery, after radiotherapy, after lymph node surgery particularly as well. So we've already done some straight up and down shoulder shrugs with the breath, but now you want to try and do some scapular shoulder rolls, really. So imagine that you're rotating the whole shoulder, the clavicle, the humerus, the shoulder blade, up, back and down. And really just think about the different aspects. What's happening to your shoulder blade as it's rotating around that chest wall? Can you make that circle bigger? Can you really, as if you're drawing a bigger and bigger. So we're starting to get some thoracic mobility in here as well, which is going to be good for the depth of your breath, but starting to massage your digestive organs as well. And then we're going to change direction. So start small, and then we're going to start making it bigger. So the whole spine is getting involved with this. And we're really rotating, and you could bring in a little bit of arm. So when you used to play choo-choo trains, think about that sort of a movement, or Tina Turner, going forwards, and we're making it bigger and bigger and bigger, and really getting that glide of the shoulder blade around the ribcage wall. We want to think about the different movements of the shoulder blade. So it can go up and down, it can go across the body and back out again, and it can go straight forward into protraction and then into retraction. So it can be quite nice to have the two hands together and go forwards and backwards and forwards and backwards. So again, thoracic rotation is happening here as well, but really think about moving the shoulder blade around the rib cage wall and backwards again. Another really nice move to do is to have the elbows bent to 90 degrees, and we're going to take the arms out to the side. Shoulder goes down as your elbow goes up. We can point the fingers down to the floor and then turn the fingers up towards the ceiling. This is really nice for getting a little bit of neural mobility. Down and up. We could add in a little bit of a head stretch as well, so we're doing all sorts of neural sliding and gliding, and we're moving all of those structures around, because nothing happens in isolation in our body. So we want to be very aware and respectful not only of muscles and connective tissue and lymphatics, but also of nerves and blood vessels moving through these spaces that can become a little bit stuck down and restricted. So we're going to come out, up, down, up, down, good. Turn the palms down and then squeeze those shoulder blades back together again. So from here, go out, turn the palms up, and really try and rotate from your shoulder. So it's not just supination, pronation from the elbow, but we're rotating the whole arm internally and externally, and feeling that ball and socket movement happening up here. Put your hand onto the shoulder and see, can you feel it moving? Now see if you can just restrict the movement from your elbow down, and now get the whole length of the arm moving again. Again, really nice, particularly if somebody has a little bit of axillary web syndrome, a little bit of cording going on. This is gorgeous for getting all of those vessels a little bit more nutrition and mobility. We're going to, if we can, come up into these elevator doors, and we're going to open the doors and close them again, and open and close. And now we're going to look to either side and center, good, and back to the center again. If we come out here, can we go up? Imagine that you're standing, you're making snow angels against the wall behind you, good. So imagine you're stuck between two panes of glass. You're squeezing the elbows back into your side, narrowing the space between your two shoulder blades, and now you're allowing the shoulder blades to move up and around the rib cage and back down again. You could actually do that standing against a wall as well, but these are just, really wants to focus on seated exercises for this particular video. We also could do a little bit of a corkscrew. So if we can bring the hands to the top of the head, inhale, exhale. And this is really nice because the hands are, kind of giving you that closed chain effect, so you can really focus on the shoulder blades coming up and down. And don't let your chin stick out. You want to keep the back of the neck long. Inhale up, exhale down, close, open. We could do a little side bend and a side bend, and we could rotate and rotate. So think about all the different ways you could move a corkscrew. So let's just go through that again. So hands on top of the head, back of the neck long, jaws relaxed. Inhale your shoulder blades up, exhale them down. Close the elbows, open them, side bend, rotate and rotate. So I'm sitting on a chair or on a cushion or on the ground, and I really want to feel my pelvis anchoring down, and I'm creating space between the rib cage and the pelvis, as well as getting that glide and slide around the thoracic wall, the rib cage and the shoulder blade. So if mobility for some reason is restricted, this is basically to show you that you have a whole toolbox available of exercises that you can do lying down, seated, as well as the more dynamic standing exercises. I hope that's helpful, and as always, if you have any questions, tag me in the Facebook comments. Bye for now.